Hi, I'm Victoria. I'm a child psychiatrist and parent coach, and I'm also mum. And today I'm going to be talking about whether you should talk to your child about difficult things such as maybe illness or death. Is it okay? Is it okay for children of any age? So I'll be chatting about that. So if that's something you're interested in, please stay tuned. So the short answer is, most things I probably would discuss with my child, but I would only really save it for the things that they are likely to encounter. So obviously things like illness and death, it's very likely that they are going to come across people who are very poorly and who may end up dying. It might be happening in your family, it might be happening with a friend. So usually it's absolutely okay to do that because this is a normal part of life, and we should be raising children who are able to deal with things that come up in life, that are normal things to come up in life. So I think avoiding that is really unhelpful, and there isn't really an age for when you can start talking to them about it. It rather depends on whether you need to start talking about them. I recently had a question in the membership just asking me about, children, one of whom I think was something like 3 and the other was 7. And of course they're going to really see things differently, but I would talk to them both just in a slightly different way. A 3-year-old is unlikely to understand the finality of death, or that illness can lead to death and that person no longer being there. But a 7-year-old is probably more likely to understand that, death means that the person doesn't come back, though they might still have some magical thinking that eventually kind of falls away from that. So you'll be talking at different levels about illness and death and what it means, but I think it's still important to discuss it, especially if it's coming up around you in the family. I probably wouldn't talk about it if it wasn't happening. I wouldn't necessarily bring it up unless it's something that, as I said, is relevant, or they've heard about, or they've brought back because maybe a friend's grandma is dying or something like that and they want to know what that is. So I absolutely would. What I probably wouldn't talk so much about is things that are unlikely to happen but sometimes we worry about. So things like really big natural disasters, or things that are events that are rare but are really, really awful. Obviously, sometimes children hear about those things on the news, or obviously they're learning about them maybe in a historical sort of sense. And when they do, obviously we do have to have a conversation with them about that. It's important that we have a conversation with them about that. But I wouldn't basically put my own worries onto them, because some of us as adults, we're quite anxious, and I know that some adults are particularly worried about catastrophic things happening, and they're always trying to sort of prepare for the worst thing occurring. And if you're that kind of adult, I would really think about how much of that you convey to your child, because what'll probably happen is you'll raise a child who is equally worried about catastrophic things happening, even though the actual likelihood of them happening is really, really rare. So I would really think about what I would really bring to them. As I said, if they've come across it, if they've learned about it, if they've heard on the news, I would probably speak to them about it, but I wouldn't necessarily bring it to their attention if it's not really something that they're aware of. And obviously you have to decide what your own child is like. Some children are extremely anxious, and when they hear about bad things happening, they can become very obsessed with the news and watching, about things that are going on in the world. And you have to think about whether that's really helpful for them, whether you want to support that, or whether you need to help them find a way of thinking about those things that's a little bit different, thinking about how likely they are, and developing ways of thinking about a world where, yes, dangerous things do happen, but ultimately we still have to live. So how to combine those things together, it's quite a difficult kind of cognitive thing to do, but I guess you need to work your own way out of doing that, and then you need to pass it on to your child. So I guess the things that you can do is, I would absolutely speak to children. If they've brought something to you, I would never not talk about it. My own daughter, I would try and find a sort of way of thinking about things. I would try and explain to them how I think about something very difficult like that makes me feel able to get on with life, and help them find their own way of thinking about things that helps them get on with life and prepare them for what's happening. If you don't talk to children, they absolutely always know something's happening. It just worries them more. The important thing is there are things that happen in life that are very difficult to deal with, but we have to find ways of doing that, and we have to find a way for our child to be able to hold it in mind and still move on in life. So that's what I think. Definitely talk to them, but maybe not necessarily bring their attention to it if that's not what they're thinking about right now.